All right. So atrial fibrillation is what we're going to discuss today. Um, my name is Rebecca, and Lindsay is my co-host. We are both emergency room nurses and registered nurses, and we have over 35 years experience. So our topic today is atrial fib. Under normal circumstances, the human heart pumps a strong and steady beat. In fact, more than 100,000 beats each day. But if you have atrial fibrillation or AFib, the heart doesn't always beat or keep pace the way that it should. Many people with AFib say they can feel their heart racing, fluttering, or skipping beats, and many people have no symptoms at all. AFib is the most common of heart rhythm disorders or arrhythmias. The regular heartbeat of atrial fibrillation or AFib is like dancing without a rhythm, moving fast without a beat, and stepping on your partner's toes. If not treated, AFib is serious. It can reduce quality of life if not treated, and can create blood clots in the heart that can travel and cause strokes or block blood flow if untreated. However, finding and treating AFib early on can help you avoid these problems. Nearly 6 million people in the US have AFib, and as long as they are compliant with their medications and they see their cardiologists regularly, they will significantly reduce their risk of stroke. To better understand AFib, I want to review the mechanics of how the heart works. So an internal electrical impulse travels within the heart, which triggers the muscle cells and the muscles to contract. Normally, the electrical signal first runs through the heart's upper chambers or the atria, and then moments later, it'll go to the lower and larger, more muscular chambers or the ventricles. The squeezing power of the lower chambers pushes blood out of the heart into the rest of the body. The pulsation of the blood that travels like a wave through the arteries to reach everywhere in the body. This creates the usual rhythmic sound we associate with a heartbeat, or lub-dub, lub-dub, lub-dub. In AFib, the electrical impulses don't work the way they should, short-circuiting in a sense. As a result, the heart beats too quickly and irregularly. These irregular impulses in the upper chambers cause the atria to quiver or fibrillate, rather than squeeze in a normal coordinated way. So they're kind of doing this instead of this. Only some electrical signals in the upper chambers are allowed to trigger the muscles of the ventricles, thanks to the heart's own safety system. And as a result, the ventricles squeeze irregularly, usually 2 to 3 times a second in untreated atrial fibrillation, or 120 to 180 beats per minute. And that's in contrast to a normal heart rate, which is 60 to 100 beats per minute. So what results is the dancing, irregular heart rhythm that is more like a fast gallop of a lame horse. So instead of lub-dub, lub-dub, it's lub-dub-dub, lub-dub-dub-dub, lub-lub-lub-dub. So it's kind of all over the place. With the rapid irregular rhythm, the heart can't pump blood as strongly as it should. The normal communication between the upper and the lower chambers of the heart is disrupted and becomes very disorganized. It can't fill fully with blood and has too little time to rest between beats. And as a result, people with atrial fibrillation often cannot exert themselves, and they feel zapped of energy fairly quickly, or notice being out of breath simply by walking up one flight of stairs. That's because they may not be getting enough oxygen. The heart isn't able to squeeze enough nutrient-rich blood out to the body. Because the heartbeat is out of sync, the blood can collect in the chambers of the heart. When this happens, blood clots can form and they can travel. That is why it's essential to listen to your body and see your doctor if you're having any new or concerning symptoms. If left untreated, atrial fibrillation can lead to strokes, heart failure, and even death. But the good news is, with treatment, these risks decrease significantly. There are 3 types of atrial fibrillation. The first one is paroxysmal, so it means that the AFib comes and goes and it stops on its own. So you may have it for 15 minutes and then it'll just disappear. Persistent atrial fibrillation lasts more than a week, and that can become permanent. And then there's permanent atrial fibrillation, which means that it's the heart's new rhythm, and the normal sinus rhythm cannot be restored. Some cases of AFib are also due to heart valve problems, but not all cases. Treatment of AFib can prevent significant problems and promote greater well-being. The overall treatment goals include preventing blood clots and strokes by the use of blood thinners, slowing down the irregular heartbeat to allow better heart function and better oxygenation to the whole body, and for some patients, resetting the heart's rhythm to the normal flow of electrical signals. AFib, along with its underlying causes and recommended treatments, can be overwhelming, but learning to live with AFib, however, is worth the effort. I'm going to hand off to Lindsay.
Okay, so we'll talk about the factors that make people more at risk for developing AFib. The chances of developing AFib increase with age, also increase with uncontrolled hypertension, heart disease, heart valve disease. Alcohol intake can also increase our chances, specifically heavy intake or binge drinking, a family history of AFib, obesity, thyroid disease, lung disease, and even sleep apnea are all factors that can put us more at risk for developing it. Episodes of AFib can happen. It can be triggered by certain activities or events in life. Some examples are binge drinking, excessive caffeine intake, periods of severe stress, for example, severe infections or illnesses, extreme emotional stress, hormone fluctuations, and even exercise when the heart rate is rapid for an extended period of time. Now, how do we detect AFib, and how do we know when our patients or family members have AFib? Like Rebecca said, not all people have symptoms. That's why it's so important to follow through on your regularly scheduled appointments and well checks with your doctors or cardiologists. Many times people end up in the doctor's office or in the emergency departments with symptoms like palpitations, feeling rapid heart rates, or a flip-flopping feeling in the chest. Some people even describe fatigue, shortness of breath, dizziness, and even chest pain. This usually leads to the completion of several tests, most commonly the EKG. An EKG is an electrocardiograph, and this test records the electrical activity of your heart. It will show AFib if AFib is present. A doctor might also order a couple of other tests, a Holter monitor, which is a monitor that stays on you and can detect the electrical activity of your heart, and usually is on for about 24 hours. You can also have something called an event monitor that you yourself can activate when you feel your symptoms. And he could also order an echocardiogram, which is essentially an ultrasound of your heart pumping ability. With all of the technology that we have today, detection of AFib can be pretty easy. Personally, I had an experience last year. My dad had a medical event, and the entire family was around, and I slapped my Apple Watch on his wrist, and in under a minute, I was able to determine that he had a new onset of AFib. Yep, you got yours on. He was in a new onset AFib. We quickly got him the treatment he needed. And the good news here is that today, my dad is no longer in AFib, takes precautions, is closely monitored, but leads a very normal, active, very active life. Which leads me to my next point. So you have AFib and you're getting treatment. Now what? The thought can be a little unsettling, especially if you can feel that irregularity in your heart. So it's important to share your concerns, your questions with your doctors and your healthcare team. Like, will I have this forever? What medication should I take and why? What can I do to prevent further episodes? Are there any things I should limit? So treatment, monitoring, and regular checkups are very important. Many people lead a very normal and healthy life with few restrictions after an AFib diagnosis.
Okay.
Yeah.
Thank you. So with what are the treatments for atrial fibrillation? The good news is that with the right treatments, you can live a good long life, like Lindsay was saying, and really not have many issues. The treatments on AFib focus on lifestyle changes and either rate control to decrease the heart rate or rhythm control to put back in normal sinus rhythm. Therapies to prevent blood clots and the strokes are also important. So lifestyle changes may include eating a heart-healthy diet full of fruits and vegetables, fiber-rich foods, lean meats and fish, and unsaturated fats like olive oils. Limiting caffeine and alcohol, getting regular exercise, managing stress, not smoking, and taking medications as directed. In addition to those, the medications that are used to prevent blood clots from forming or to dissolve existing clots would be anticoagulants or blood thinners, or to restore the heart's rate or rhythm. Rate controlling meds slow the heart rate during AFib and may relieve symptoms caused by a fast heart rate. And rhythm controlling medications are used to return the heart to its normal rhythm and keep AFib from returning. This may relieve symptoms caused by an irregular heart rate. At times, medical procedures may be needed to control rate and rhythm of AFib, like an electrical cardioversion or a catheter-based ablation. There's also a surgical maze procedure, and sometimes pacemakers are needed. People wonder if AFib alone with no other risks can increase the risk of developing coronavirus. This is a complicated area because we're only now collecting all the data, but from collecting data from various experts, they have not seen any data to indicate that those with AFib with no other risk factors are at higher risk. The WHO said that it seems unlikely if you have well-controlled AFib and are on an anticoagulant, it should not put you at a higher risk for COVID. So remember, living with or being diagnosed with AFib may be unsettling, but with the right treatments, regular cardiology appointments, and some lifestyle changes, those who have been diagnosed can live long, normal lives, and the key is taking care of and being in tune with your body. A few other updates for COVID this week. I just want to give you some updated information. The virus has resulted in 4.2 million infections as of today, with 287,000 deaths, but 1.5 million, have recovered. And remember that these recoveries are only the recoveries that have been tested. There are many people walking around without symptoms who have never been tested, so that recovery number is much higher. There are tons of different symptoms that can range from cough to shortness of breath, fevers, chills, shaking chills, muscle pains, headache, sore throat, loss of taste or smell, change in mental status or confusion, nausea, vomiting, diarrhea, fatigue, decreased or no appetite, general body aches, pink eye, rashes or swelling of your toes, and sinus pressure. So the symptomology is kind of all over the board. So if you're not feeling well, it could be a time to get tested. And that's really it for today. So let me unmute everyone. Does anybody have any questions about anything? Bill, do you have any questions?
Either one, and no.
Okay.
No, I have, I have AFib. Does anybody else have AFib here, or just me?
I have AFib.
You got it? Okay.
Yeah.
And
30 years.
I had I had open heart surgery last year,
Yeah.
and I had my aortic valve replaced.
Hmm.
And when he was in there, he did the maze, even though my cardiologist said it's not going to work.
Okay.
I said, well, it's a shot. He was already in there, so he said, I'll do it anyway. And then he did what they called he stapled off this little section of your heart that 90% of all blood clots form there. It's a little sac somewhere on the heart. So he just stapled that off and reduced my chances of blood clot tremendously by doing that. So I had a 3-for-1 procedure.
Well, there you go.
Yeah. Dr. Brown.
Did he charge extra?
I don't know. I didn't, thank God I have good insurance because it was, I don't know, $250,000 for the stay in the hospital. I don't know if that was a discount or not.